Good afternoon, everyone, and welcome to our audience, both in the Kellogg Hub and to all of those of you who are joining us virtually from wherever you are around the world. We're so delighted to have you all with us. Just before I hand over to our speaker, a couple of housekeeping points, if I may. The first of which is that this event is being live streamed, and we also have a photographer and a videographer with us. So I'd also like to ask people to perhaps put their mobile phones on silent or turn them off if you haven't already. There'll be time at the end of the session to ask questions. And for those of you who are with us in the room, just raise a hand, we'll bring a microphone to you. For those of you who are joining us online, my colleague Nicola is ready and waiting to take your questions that you'll need to put in the chat. We can then read them out on your behalf. So without further ado, I'm delighted to hand over to our speaker this afternoon, Dr. Juliet Carpenter, who is a research fellow at Kellogg College and specifically with our Global Centre on Healthcare and Urbanisation. So Juliet, over to you. Thank you.
Thank you very much, Rebecca, and welcome to everyone in the room and online. It's great to see everyone here. My name's Juliet Carpenter. I'm a research fellow at the Global Centre on Healthcare and Urbanisation, GCHU, which is a research centre here based at Kellogg College. And what I want to do today is present some work we've been working on over the last 18 months on creating healthy cities. It's a project I've been working on with the team at GCHU, including Dr. David Howard, who was going to be here today, unfortunately, due to a family matter, hasn't been able to come today. Dr. Georgia Richards, who has moved over to a teaching post at Oxford with other roles as well, so she's not here. But Professor Carl Hennigan and our Centre Administrator, Robert Weavers. So it very much is a team effort, the work that we've been doing. And I just want to outline what I'm going to be talking about today. So let me just share my screen. So is that all okay from tech point of view? Great. So hopefully everyone can see that now. So just to outline what I'll be talking about this afternoon, just to say a little bit about GCHU and who we are, then to say a bit about what is a healthy city. There are lots of definitions, and I just want to talk you through the definition that we've been using in the centre. And then I want to say a bit about the project that we've been working on, what creates healthy cities, working with the Commission on Creating Healthy Cities that was set up about 18 months ago. And I'm going to take you through some of the findings of that report in terms of the built environment, transport and mobility, health and well-being, and in terms of good governance. And leading on from the good governance theme, I also want to say a little bit about the project we've been involved in here in Oxford called Street Voice, which was a citizens' jury addressing issues of transport, health and climate change. So I'll say a bit about that linking to good governance. And then I'll say a bit about where next, what we're planning to do in the future. And I'd love to hear your reaction to the presentation and some of the themes coming out in a Q&A at the end. And just to say, the report itself, we do have copies. So if you're interested to take a copy away, you're more than welcome. So GCHU, the Global Centre on Healthcare and Urbanisation. And I suppose, as it says, what it says on the tin, what we're trying to do is bring together healthcare and health interests with urbanisation. That, in our case, is an interest in sustainable urban development. And what we're seeking to do is to make urban centres environmentally, economically, and socially sustainable. So we've got the 3 pillars of sustainable development. and to provide an environment that supports and sustains health and well-being. So bringing in this interest in health and well-being in the city. And so we have these interdisciplinary approaches, particularly bringing together sustainable urban development and the links that Kellogg has with continuing education and the Masters and DPhil programme in sustainable urban development. And then on the other side, evidence-based healthcare based in primary care. And again, the Masters and DPhil programmes related to that in primary care. So those are the two key disciplinary approaches, although as you'll see, it does touch on all sorts of other areas as well, this interest in healthy cities. In terms of our mission as a centre, we've got four main aims. Firstly, research, clearly, looking at this intersection between sustainable urban development and health and well-being. Secondly, very much interested in collaboration, so building these interdisciplinary networks, not just in sustainable urban development, geography, urban planning and health, but reaching out to transport, reaching out to climate scientists, reaching out to really the broad range of interdisciplinary subjects that touch on healthy cities. Then in terms of education, we're aiming to form this new generation of leaders in these areas, not only through the programs that we're running in primary care and continuing education, but also through a program of micro internships that we run through the Global Centre. So over the last year, we've had 18 micro interns who are either undergraduate or postgraduate, and they come for a week and spend a week with us, and they follow. It's like an internship, but it's a mini one over a week, and they support us. We feed into their studies, and so it's a real sort of synergy between their studies and their interests and ours. So we've been running that as well over the last year. And then finally, impacts on policy. All our work is very much focused on trying to impact and make cities better. So that might be links with policymakers, both at the local level and the central government level, and more broadly, thinking about how we can really have an impact through our work in terms of creating healthy cities. So linked to all the work that we do is very much an interest in public engagement, and this is one of the other key themes of the work that we do. Active public engagement and encouraging debate on these questions around the built environment, urban development, and health and quality of life. So really trying to sort of engage with the public. So that's engaging with local residents, local community groups, local stakeholders at both councils that we have here in Oxford, and more broadly in terms of NGOs, the private sector, to really try and bring people together. And we do this through a series of public seminars that we hold here in the hub, twice a term in week 1 and week 8. And for those who are based in Oxford, you might be interested to come along to the one in October on creating healthy cities, or the one in week 8 of the first term there, which is around citizens' juries. So I'll be saying a little bit about both those, but if you'd like to find out more, then do come along to our public seminars at Kellogg, and details are on our website. So I just want to say a little bit about what we are defining as a healthy city. Many of you may know that the World Health Organization has had a Healthy Cities programme running for the last 30 years or so. And they've developed a definition through extensive reading and consulting with stakeholders, and to us that seemed like a really solid definition to start with, taking in both physical and social environments, very much thinking about people in cities and how their prospects and their future well-being can be taken care of through an approach to healthy cities. So we took the World Health Organization definition, and I think what it does do as well is really emphasize the fact that health and place are inextricably linked. There's very strong links between health and place supports individuals' health and well-being. And so it's these sort of, the symbiotic relationship, if you like, between health and well-being and place, which we're interested in exploring through our work. And just to set it in the context of sort of wider debates about the wider determinants of health, Anyone who works in health inequalities will be familiar with this diagram, which really sort of sums up all the different influences in a neighbourhood and the communities within a neighbourhood in terms of the lifestyle, community and local economy aspects of the influences on health and well-being. And then more broadly around built environment, so that's housing, that's urban design, what we do with our streets, how we plan the city, as well as the natural environment. So that's natural habitats, that's air quality, water quality, green spaces, green and blue spaces. So, and then set within the global ecosystem. So wider debates about climate change and changes to the climate in terms of climate stability and biodiversity and the impacts that they can have on health and well-being. So there's very much a sort of systems approach, thinking about a community, a neighbourhood, a community, and the different influences on it in terms of health and well-being of the population. So now I want to move over and say a little bit about this project that we've been working on over the last 18 months. It was well, GCHU was set up in 2019, just before the pandemic. And once the pandemic sort of, had run its course over a number of months, a number of people here in Kellogg and more broadly started thinking about the implications of the pandemic for cities and for health in cities. And really that was the sort of the seed of the idea for the Commission on Creating Healthy Cities, which was then established in 2020, bringing together a whole range of different commissioners, both from the public and private sectors, NGOs, within the UK context, to think about how we can build out of the pandemic in a more healthy and sustainable way for communities, for citizens, for residents. So it's a collaboration between GCHU and the Prince's Foundation, as well as other funders as well. And we have Dr. Ralph Water with us, and other funders have also contributed to the report on what creates healthy cities. And the aim was to provide evidence-based recommendations to UK city leaders and citizens on improving health and well-being in communities. So that was the broad overarching aim. And we brought together a whole range of commissioners, 12 commissioners, 10 subgroup members, organised and chaired by Lord Richard Best, who is former director of the Joseph Rowntree Foundation, if any of you are familiar with that. A very strong leader and thinker around social housing, around regeneration, polarisation, inequalities in the city. So very much from the sort of urbanisation, sustainable urban development side. And chairing the International Advisory Board was Lord Nigel Crisp, former Chief Executive of the National Health Service. So again, we have this urban health coming together to try and bring these different perspectives to the key question. And our role at GCHU was to support the Commission on Creating Healthy Cities by running and launching and managing the International Call for Evidence, which ran in 2021. So we set out a whole raft of different questions that we distributed through various networks, through emails, through all our different stakeholder networks, to draw in evidence related to what creates healthy cities. We also did a number of high-level stakeholder interviews with the World Health Organization, with the WEF, with PHE, the Public Health England, which then became OHID, the Office for Health Improvement and Disparities. And we also ran 4 expert workshops. So we brought together leading thinkers, stakeholders, key players under the 4 themes that we were interested in through the Commission. And then in parallel to that, we also undertook a systematic scoping review. So that was a review of all the evidence that we could find published in academic journals between 2010, sorry, and 2021. And so I'll say a bit more about that. That has led to the creation of what we're calling the Healthy Cities Toolkit, which is an online toolkit that people can log on to and click through the evidence to find what works in different circumstances. And I'll say a little bit more about the toolkit later on. So I just want to run through the four headings that we were dealing with and bring some of the sort of headline findings that we got from the evidence call and the stakeholder interviews. So this theme, built environment, urban design and placemaking, very much interested in housing, in urban design, in how we create better places. And one of the key areas was around housing, more affordable housing, and in particular housing quality. And research from the BRE, the Building Research Establishment, has shown that there are around 3.5 million so-called poor homes in England. That is homes that are understandard in terms of damp, in terms of cold, in terms of insulation. So poor homes in terms of the actual structure, about 3.5 million of those in England. And BRE estimated that if £10 billion were invested in these poor housing, there'd be an annual saving of £1.4 billion to the NHS in terms of respiratory diseases and the problems that come with poorly ventilated housing and cold and damp housing. So significant savings from investing in some of this poor housing. But there are other rationales as well in terms of climate change, for example, energy efficiency. 77% of direct building CO2 emissions come from homes. And so this dovetails nicely with the government's net zero agenda, its net zero strategy that it produced in 2021 through BASE, and how there are these links between healthy homes, healthy people, healthy communities, and savings that can be made, both the NHS, but also addressing climate change and our CO2 emissions. So there are these links between so many agendas that coalesce around health and well-being and the investment that's so badly needed to address so many of these agendas. Just running through some of the other headlines there, health-related planning policies. So in Wales and in Scotland, for example, there are specific policies which mainstream health and well-being into the planning system, whereas in England, we don't have that. We have the National Planning Policy Framework, the NPPF, but that doesn't really put health and well-being front and centre. And so one of the recommendations was that the English planning system should really focus on health and well-being as one of its key rationales, if you like. Then in terms of, for example, the bottom one, funding prioritisation, the ministry responsible for housing, community regeneration, DLUC, which is the Levelling Up, Department for Levelling Up Communities and Housing, has set aside specific funding for this so-called levelling up agenda. But again, this health and well-being, yes, they feature, but not as prominently as the evidence would suggest would be beneficial, both for communities and for cities. So again, it's about funding prioritisation and really putting forward health and well-being as one of the key drivers of other policy agendas. I'll say a bit about the second theme that we were looking at, transport and mobility, which included infrastructure and technology as well. And some interesting data came out of the evidence review, in particularly around the value of walking and cycling, but particularly walking. And this data on the left there was from the Transport for London's Walking Action Plan, which found that for 20 minutes walking a day for every Londoner would save 1.6 billion in NHS treatment costs, would save in terms of early deaths, stroke and heart disease, cases of depression, just by 20 minutes walking a day for each Londoner. So enormous health dividends from being active, from reducing car dependency, from reducing car use. Then there's the issue around air pollution and the particular impacts that has on respiratory diseases and the health of urban populations. all this leading to the need to promote and advocate for active travel. So that's walking, wheeling, cycling, scooting, and this links to policy initiatives such as low traffic neighbourhoods. And many of you may know, certainly if you live in Oxford, how certain local authorities have been very proactive in introducing low traffic neighbourhoods as a way of addressing some of these issues around keeping active, addressing climate change and health and wellbeing initiatives. So those are some of the key headlines coming from the transport and mobility section. Now, in terms of health and wellbeing, this covered public health more broadly, as well as the issue of social prescribing and the importance of social prescribing, food and exercise. And so in terms of planning for exercise, there are real, here under this theme, there are real health inequalities. There are health inequalities across the board, but we really noticed in terms of access to green space, for example, access to healthy food. There are real disparities within the city. I mean, here, for example, in Oxford, life expectancy between the most well-off and the least well-off neighbourhoods in the city is 9.3 years for men, it's 5.7 years for women. So enormous health disparities here in a city which is relatively well-off. There are these pockets of deprivation. And so, for example, the data shows that 35% of low-income households are within 10 minutes walk of nature, compared to 59% in more affluent households. So it's about thinking, how can we build in access to blue and green spaces throughout the city, not just in more well-off areas. Then there's access to healthy food, and that's a key issue that's been in the news, well, certainly since the National Food Strategy was published last year by Henry Dimbleby and his team around access to healthy food. But so that's about education. It's about introducing young children to the idea that you can grow food, you can cook from ingredients rather than having processed foods, and the implications of a less healthy diet on obesity are evident in the data as well. But I mean, with the cost of living crisis, I think we're all very aware of the squeeze on household budgets, and when an apple costs the same as a small packet of biscuits, I think you can see why people on tight budgets will reach for less healthy food, and that's going to be a real problem again going into the future, I think, in terms of the crisis that we're facing in the long term, not just on the energy front, but in healthy eating and the health implications of that. And then in terms of social prescribing, which is something there's a strong team in primary care here at Oxford that researches into social prescribing. That is the value of prescribing not necessarily medicine through a clinical approach, but linking to other ways that people can address health, and particularly mental health issues, which might be, for example, having more access to green space. It might be exercise classes or yoga classes, or even help with financial advice for those with mental health problems linked to the cost of living crisis, for example. So this idea of social prescribing being a really important key area, along with others, in addressing some of the health and wellbeing issues in the city really came through strongly in the evidence review. And finally, out of our 4 themes, there was good governance. And really, we can't think about how to create healthy cities without thinking about the mechanisms for how to get there. And so we reviewed evidence on the different factors that can contribute to supporting health and wellbeing in the city. And the 3 sort of headlines to come out of the evidence was the need for interdepartmental coordination. And just as an anecdote, we were actually reporting on this on these findings to Delux, to the Department for Levelling Up, last week on Wednesday. And in advance of that, we emailed saying, well, great that Delux will be there. are you inviting other departments as well? And they said, oh no, I don't think we are. It's a Delux seminar. And that really struck me as, you know, the silos that we're, even when we're presenting to Delux, and the key message is you need to speak to your colleagues. You need to, you know, everyone has to understand this agenda. It's not just for Delux. It's not just for the Levelling Up department. Yeah, I suppose that underlines the issue there. Then in terms of devolution to local government, and I think cities really have tried to push this agenda, and it's moving forward slowly, the role that local government can and should play in supporting health and wellbeing in their cities, rather than decisions being taken in central government. So I think that's an important message as well. And then civic engagement, and this sort of covered a whole range of areas of getting people involved in, you know, community action and engaging with elected representatives, and also experimenting with some deliberative democratic processes. So how else can we find out what communities want for their city, rather than just doing a ballot box, rather than, you know, sticking to an electoral cycle of voting through first past the post, and taking these interests that we have in cities, in healthy cities, and exploring different ways of hearing voices in the city and feeding those into policy. We've been involved in a citizens jury called Street Voice, which we set up at the beginning of the year, and it's here in Oxford, in the area of Headington, which some of you may know. And I'll just say a little bit about that now. I could do a whole presentation on Street Voice. It's been a fascinating experience, and we're actually presenting next week, at the end of the month, so in 2 weeks' time, to the council, to the county council. But just to give you a sort of brief sketch of how we see citizens' juries can feed into this process of bringing in different voices to the policy agenda of health and wellbeing in the city. So what we did was set up and organised and ran the citizens' jury, focusing on transport, health and climate change in the city. And it was a collaboration between ourselves at GCHU and primary care, and was endorsed by Oxfordshire County Council, but was very much independent of it. So we were very keen to maintain that independence. Anyone who's based in Oxford will know that the low traffic neighbourhoods and issues around transport in the city have been very contentious recently, particularly since the low traffic neighbourhoods have been introduced. And we wanted to maintain our distance from Oxfordshire County Council, while at the same time involving them in as much as making sure that they're aware that it was happening, and they endorsed it right at the beginning before we started, and agreed to accept the report and debate it and act on recommendations that they felt that they could act on. So they were very much sort of backseat partners, but were involved right from the beginning. So the Street Voice sessions involved 16 jurors from Headington, meeting over 4 weekends in June and July of this year. And the key question, which anyone who knows about citizens' juries, I mean, the question is the key thing that really runs through the whole debates and the deliberations that happen. And so with the advisory group that we had, we spent some time honing the question to make sure it really focused on what we were interested in and what we were trying to get the answer to. So we chose, how can we travel where we need to in Oxford in a way that's good for health and the climate? So we were bringing in the transport issue. You know, how do we get around? How can you move around a city? And you know, the congestion in Oxford at peak times is really quite, it's got to be seen to be believed. So everyone recognises that transport and travel are an issue in Oxford, but how can we travel around in a way that's sustainable, that's good for health, and there are issues, enormous issues around air pollution and air quality in Oxford, and the climate. So Oxfordshire County Council has declared a climate emergency, and we were starting from the premise that we are living through a climate emergency, and we really must find ways to meet our targets, our 1.5 target, and net zero, and contribute to the net zero strategy that BASE has published last year. So, so I won't go into enormous detail, because I mean, we did come up with they came up with 157 recommendations. We had an initial presentation to the county cabinet in July with some emerging findings, and the full report will go to scrutiny committee at the end of this month with the 157 recommendations. Just to give you some of the headlines, after significant debate and deliberation, there was agreement that LTNs were a good system. They were endorsed, although there need to be changes, there need to be some tweaking, and the detail of that is in the report that we're presenting to the county council at the end of the month. There was significant support for buses, but again, in terms of the cost of buses, the ticketing, and all sorts of other areas, buses were a real focus of the discussion. But again, there were changes recommended to the council. Active travel was a significant area that we talked about, in particular cycling for children and people cycling to school, kids cycling to school and being more active about getting to school and getting back. And so that was a key recommendation. Then in terms of the council, there needs to be better communication. They need to communicate these changes better. A lot of people thought they were coming from on high, imposed without the appropriate consultation. So there needs to be more citizens' engagement. And also what did come through strongly was the value that those 16 jurors felt about the process of Street Voice, about this process of citizens' juries, and how we brought together a completely representative sample of 16 jurors who represented the profile of the population of Oxford in all its diversity. And there were very different views in the room at the beginning, and we managed to get recommendations out of it through this discussion and deliberation, which took time, which took resources. And I'm not saying that it's feasible or realistic to think that that could happen repeatedly, but I think it really, that process really shows the value of a citizens' jury and how it can contribute to policy making around these issues of health and wellbeing, transport, climate change, and the whole sustainability agenda. So that's a sort of just a quick canter through the Street Voice project, as an aside, if you like. And now I'll just say a little bit about the Healthy Cities Toolkit. So that was running in parallel to the call for evidence and the stakeholder interviews, giving the evidence that I've already presented. So this is a parallel related piece of work where we did a systematic scoping review. In fact, initially over 1,000 evidence-based review articles were thrown up, if you like, by our initial search. And from those were screened down to around 260 evidence-based reviews. So these are articles that review detailed evidence, and we were reviewing the reviews, if you like. And what we've done is create this easy to use website which reviews the impact, the resource implications, and the quality of the evidence around a whole raft of different themes related to healthy cities. When it's completed, it's still in operation at the moment. You can go onto the website. We have 7 themes at the moment, but we will have up to 50 themes in the end. And what you can do is click on the theme and review the evidence that the reviews present, and then our assessment of what the impact of these initiatives can be, what the resource implications are, and what the quality of the evidence that they're presenting is. So that's the Healthy Cities Toolkit is aimed at policymakers, aimed at citizens as well, to really try and explore some of the some of the interventions that that can address problems around healthy cities, health and wellbeing in cities. And I'll just take you through a couple of the sort of headlines from a couple of the themes here. So in terms of active travel, for example, we reviewed 14 reviews with over 500 primary studies within those. And you can imagine there's a broad range of findings. So I'm just going to sort of give you some of the headlines, but clearly issues around infrastructure are critical, and anyone who cycles will know that, you know, potholes and, you know, cycle lanes that disappear into nothing and then you're thrown into the traffic again are key. So, you know, that was one of the key findings of the reviews. Issues around traffic calming, and again, low traffic neighbourhoods is one example of that to come out through the review. Issues around public realm and placemaking, street aesthetics, making places nicer to walk in, that people want to walk in, rather than places where people would rather get in their car. So we're talking about planters, we're talking about you know, meeting spaces, activation initiatives, and then mixed use areas. So many of you might have heard of the 20-minute neighbourhood. Paris, for example, has been promoting this idea of living locally and walking and cycling to places that you need to access. And so that, again, was one of the key findings. But again, this need for interdisciplinary policy teams. So although active travel is ostensibly a transport planning issue, it's about urban planning, it's about public health, it's about, you know, it goes across the board. And what we really need to see is policy teams bringing in different voices from across the local authority to work collaboratively on these interventions, which isn't happening really as much as it should. And then I'll just say a little bit about housing and health. So through the toolkit, we covered 10 reviews and again, over 500 primary studies. And some of the findings, I mean, we've talked about them already, this inextricable link between poor housing and poor health, and how that really is a priority for government to address these so-called poor housing through issues around, through interventions such as ventilation, thermal performance standards, heating, cooling, installation, and the Green Homes Grant for retrofitting. I mean, this was introduced about 2 years ago by the government. It lasted about 6 months, was very poorly thought through, and basically collapsed because it hadn't been set up properly. But that Green Homes Grants programme is really you know, something that's really waiting to be launched again, because retrofitting is a no-brainer in terms of health, in terms of well-being of the population, in terms of climate change. So it hits all those agendas. So I'm expecting something to come out quite soon around retrofitting and how the government really will be pushing that agenda in the coming years. Then issues around housing affordability, particularly in the private sector, but in so-called affordable housing, how that's not affordable for so many people, and the impacts of mental health, of worries about housing and affordability, and the cost of living crisis as we see it now. And then, you know, in terms of overcrowding, so a recent study from Shelter showed that 730,000 children in social housing are living in overcrowded housing, and the impacts of that on family life, on communities, physical and mental health of the children plus the parents, you know, and the impacts that has. So that's another agenda that really needs addressing. So just coming through to some of the key messages of the report. Basically, I've mentioned already, and the English planning system is lagging behind its Welsh and Scottish counterparts here. Wales has been quite forward thinking in introducing in 2015 this Wellbeing of Future Generations Act, with a whole raft, 7 different themes that are really embedded within policy making at all levels. And so it's these themes need to be taken into account in every policy that's introduced in Wales. And it touches on health and wellbeing, but it also touches on environment. It touches on this sort of holistic approach to thinking about the well-being of future generations. And so that's Wales's approach. In Scotland, they have a place standard tool, and there they have 12 different indicators as a way of thinking about place more holistically, including health and well-being, but also around green space, around blue space, around transport, about cohesion, this whole sort of holistic approach to thinking about place and policies that are appropriate for places. And so it's about embedding this long-term joined up thinking for health and well-being within the planning system, which, as I say, in the English planning system, we don't have at the moment. And it's really one of the key messages that, strong messages that's coming out of the report. And then just in terms of the rationale for addressing this, I mean, we've seen these wider inequalities in society in terms of health inequalities between health life expectancy in different parts of the city, but also improving a city's economy and productivity, how health and well-being can support that. There were clear links between the need to address health and well-being and combating climate change, particularly when we're talking about the built environment and the CO2 emissions coming from the built environment, and how there's a real win-win there that could be capitalised on. And then reducing escalating costs for NHS and social care. We found evidence that investment in health and well-being plays dividends in terms of reducing costs to NHS and social care. So there's lots of strong rationales for embedding health and well-being in all sorts of different policy areas. And partly because of that, we thought it would be great to speak to Delux, to the Department for Levelling Up Communities and Housing, and we presented the report to them, as I say, last week. It was actually on Wednesday, our webinar with them. So Liz Truss had taken over the premiership on the Tuesday. So there were the chief scientific officer, advisor, Professor Alan Penn, said, terribly sorry, people are a bit busy, writing new briefings, getting together the reports for the new ministers coming in. But there was a good crowd of policymakers there. We were really engaging with them, lots and lots of interest in the report. But one of the key things to come out was, one of the first questions was, we're aware that over the next 2 years, running up to the next election, the growth agenda is going to be absolutely key. And how can we make a case for health and well-being slanted towards the growth agenda? And for us, there are key connections between supporting health and well-being and the growth agenda. Not least, a healthy workforce is a more productive workforce. But also the reduction in private car journeys means less congestion, unproductive time in traffic jams, less consumption of fossil fuels, so hitting the net zero agenda as well. And then investment in infrastructure and housing generates economic activity, especially in so-called left behind areas, those areas which are more disadvantaged, more deprived, and that can attract private investment. So there are lots of arguments for supporting health and well-being, which also hit the growth agenda policy sort of framework. And Simon Clarke, the new minister for Delux, who was appointed that Wednesday morning, actually comes from Treasury. So he'll understand these economic arguments. And so there's some hope that some of these policy messages will actually feed through in the coming weeks and months into government and government thinking. So where next? For GCHU and our interest in building healthy cities of the future. So we're currently disseminating these key messages at local and national level. We've got significant interest as well locally from Oxford City Council, who are keen to engage with us around the agenda and some of the recommendations coming out of the report. We're going to continue our work with citizens' juries, particularly focusing, we hope, in the coming weeks and months on children and young people, and how really their voices aren't heard as as loudly as they should be on health and wellbeing, and thinking about, you know, wellbeing for the future generations. Our Street Voice citizens jury just covered age 18 plus, and there are sort of additional complications around involving children and young people, which can be addressed over time. We didn't have the time to address those in terms of safeguarding and putting things in place to make sure that everything in terms of ethics is done as it should be. But hopefully we're going to develop that, and we actually built links with a local school doing the citizens jury Street Voice. A school teacher came and presented to the jury, and so we're going to build on those links as well. And then identify areas for further research. So just a couple of areas here. There's a whole raft of areas that we could explore, particularly this idea of regeneration in the 20-minute neighbourhood, and the impacts on health and well-being, and also around social infrastructure. So that could be sort of community centres, community hubs, places where people can come together and address some of these perhaps more issues around mental health and loneliness in the city that impact on health and well-being. So around community cohesion. So that's just some of the ideas that we're interested in pursuing in the coming months through this report. So just to say, the report, you can download it, or if you'd like a paper copy, there are copies here. You can explore the Street Voice website if you're interested in finding out more about the citizens jury. Do follow us on Twitter. We did actually tweet out each of the sessions regularly through Street Voice. So if you scroll back, you'll see some of the presentations and stuff if you're interested in that. And you know, feel free to get in touch if you'd like to explore any of these debates, you know, in more depth, or come and speak to me at the end, or indeed ask a question right now. So I'd love to take questions from the floor, or indeed from those joining online. So yeah, the floor is open. I'd be happy to take questions.
Thank you for that wonderful presentation. I have a background in art therapy and spirituality, and I take the question of what support are you giving to people's souls, to people's hearts. So music therapy, art therapy, spirituality centers. What space that you like? You've mentioned 3 spaces, which are fine, healthy food, which is fine, but man, that's something else, not just
Absolutely, yeah, and that very much comes into the social prescribing element. So a recognition that alternative approaches through art, through music, can really impact on people's lives, the quality of life, and health and well-being, particularly sort of mental health issues. And that's very much, yeah, within the social prescribing, that area is really important. And yeah, totally agree. And it's certainly, yeah, just didn't have time to go into all the detail, but absolutely key, spot on, I think, in terms of alternative approaches to addressing health and well-being, definitely.
Thank you very much for a wonderful presentation. My question is whether you explored any of the existing living labs. I work in one of such labs in Carbon Science Innovation Campus. We are exploring introduction of connected autonomous vehicles as part of transportation option. And we also had a community of engagement, as you suggested here. So before we started, people were very apprehensive and they didn't know what to expect. After they experienced it, after 3 months only, they had completely different view. So what did you think about involving living labs as like a source for your reports?
Yeah, great question, and certainly living labs are a you know, fascinating way of drawing in different stakeholders, different views, particularly residents, into sort of policy making. We were quite restricted in what we could do in the time and the resources available. So we didn't explore living labs, although they did come up in evidence, and the importance of living labs, and basically under the good governance, so important to hear the different voices. But it'd be definitely something worth exploring in the future, and it'd be brilliant to set up a living lab. Perhaps it's something we could do here in Oxford to explore some of these issues in a live setting, sort of action research.
The link lab to Oxford from Tuesday next week.
Oh, okay, right.
Driving, so you're
That would be brilliant. Yeah, we'd really enjoy that.
Hi, I work for part of a company called The Nature Effect, which is a community interest company in Oxford, based in East Oxford. My particular role is landscaping, designing forest schools. I literally helped to build a urban wildlife park within Florence Park, which is a big park in the east of Oxford. So I've got quite a lot of experience with this, but actually what I really wanted to ask, and this is a very personal question of my experience of living in East Oxford, is did your street voice and your jury give you any idea of why the extraordinary levels of aggression and violence have arisen around the LTNs? I mean, I personally have people drive, Land Rovers at me, and and I live in those streets, and it's very, I've been quite shocked by it. I've lived in those streets for nearly 40 years, and I've been really shocked by the aggression and hatred that certain sections of the community seem to feel towards their Catholic neighbours. I just wondered if anything that illuminated this to you.
Well, yes, I mean, it's certainly a very hot topic here in Oxford, isn't it? And I think everyone's been quite shocked by the reactions of certain people in these neighbourhoods, sort of the violence and the anger and the bitterness. In terms of what Street Voice was doing, I mean, we recognised that it was a very contentious issue, and we were prepared for that kind of sort of argument to surface. In fact, what we did was we had a facilitator who employs a process called consensus facilitation. And so even if some of those feelings had been in the room and had the potential to surface, through the facilitation, I think we managed to bring together opposing views, and for people to see the other perspective, see the other side. And I think the danger is at the moment, I mean, one of the problems, and people have said it multiple times, is that through social media and through different channels where you're not actually in dialogue and you're not sort of deliberating, you're not sort of discussing rationally, but you're sounding off on social media and don't have to justify any positions. I think social media has got a lot to answer for in terms of stoking the animosity between the different sides. And in Street Voice, we were aware that had the potential to happen. And through this consensus facilitation, I think we managed to get people discussing, and they had four days, 4 weekends to really try and understand different perspectives. And so we had people presenting from activist groups, campaigning groups, both for and against LTNs, and we had resident statements read out. So we didn't actually invite residents, we didn't call witnesses in, but we asked for written statements from witnesses on both sides. And so the jurors really did get a feel for the different arguments very strongly on both sides. And then through this process of discussion and deliberation over time, I think they got to understand and to really talk about the issues. And I think that's what's missing at the moment in the head-to-head sort of conflicts that are happening at the moment in East Oxford and elsewhere. And so I suppose the conclusion of that is that you need time to sort of talk through and try and resolve differences and try for people to see each other's positions. But the reality is that that can't happen necessarily in a place like Florence Park or other areas where you can't bring everyone together. I mean, we were very privileged to be able to bring these 16 jurors together, and the recommendations they make, I think, are quite measured. They recognise the different sides. They say, yes, LTNs are great for some things and for some processes, in some ways, but there need to be changes as well to take account of different perspectives and different needs, mobility needs and things. So over time, I think perhaps and certainly when the council has read the report that we're putting forward with a whole raft of recommendations that have been penned through a deliberative democratic process that we've followed. This is a process that's recognised worldwide, so there is a legitimacy to the recommendations, that perhaps with some tweaks that the different sides will see that there is a way forward.
Juliet, we have a question from our online audience, and in our last 4 minutes, I've got a question here from a Kellogg alum based in the States, Darren. Thank you for the interesting presentation. There are clearly many well-conceived approaches, but some are easier to implement than others. Has a programme been put together that lays out a plan for implementation, possibly that highlights lowest cost, highest impact areas that can be prioritised for communities that can't afford everything?
Yeah, thank you very much for the question. That's really sort of spot on. I mean, that's the point we've got to at the moment. And what we really need to do now, I mean, we spent 18 months reviewing the literature, producing the report. Now we're seeing the next 18 months is really taking that report and trying to implement it in different places and trying to get it adopted in different places. And that involves, of course, being realistic about, what communities and what local authorities in this, age of austerity that we're being, that's coming to hit us very, very soon, how are local authorities going to afford some of these implement some of these changes and some of these urgent interventions. And I think that's our next stage, is to think about how these recommendations can be put forward in an implementable way, in a pragmatic way, that will have maximum impact for least cost, given the financial crisis that's already with us. But I think that's absolutely right, a really good point there. And hoping that some of these recommendations will see the light of day in various policy agendas, either locally or nationally.
Super. Thank you so much. We've come to the end of our hour slot this afternoon. So Juliet, thank you so very, very much for what I think is a really thought-provoking presentation. So thank you, and thank you to everyone who's been watching online. So it just leaves me to say thanks to Juliet, and your contact details are on the screen, so we really would encourage you to get in touch. This is a topic that's only going to become more important. Thank you. Okay.
Let's do it as you are there.
Oh yeah, sure.
Just turning your shoulder back.